Welcome to the Heart of Healthcare podcast.
Hello, listeners, and welcome back to the Heart of Healthcare. I am Steve Krause, your host, and I am here today with a friend of mine, a fellow I've gotten to work a lot with, Robin Shah, who is the founder and CEO of Thyme Care, as well as a number of other really interesting, involved in a number of really other interesting companies in the oncology space, and a true expert in that area. So I'm really excited to talk to Robin today about not only his entrepreneurial journey, about Thyme Care, the company he's building, but about oncology care in America in general. Robin, welcome to the Heart of Healthcare.
Thank you, Steve, and thanks for having me on your podcast.
Oh, man, I'm excited for it. So I want to start. I mean, you've had a really interesting entrepreneurial journey to today. But I'm curious, like I usually find with lots of successful people, which I put you in that category, there's usually a defining moment earlier in their life, whether it be as a kid or maybe in their early career that sort of has shaped them or guided them or inspired them to be where they are today. I'm curious what that is for you.
Oh, great question. I would say, look, I grew up in a traditional Indian family where success was defined by being a physician or a lawyer. But more importantly, the underpinning of that is that failure didn't exist in my household. And so I would say early on, one of the big things that probably drove me to where I am today, and I didn't know what an entrepreneur was or starting a company meant in the 7th or 8th grade. But I do know that there was no such thing as failing to my parents. And so I'm sure that was probably the catalyst that got me to where I am today. And I think I don't think they actually recognized that they did that because they did it through tough love. But that's definitely one of the things that drives me to where I am today. Yeah.
You mentioned a family that your father was actually a provider. And so I think it's interesting. We're going to talk a lot about your background, but you know, you, for the first part, I mean, you went to college and then went to business school, but for the first job out of college was working for your dad in his oncology practice, I believe. So you were you destined to be like in the dad's practice? Was that the thought because you were there for 5 years? It wasn't like you were there for a college internship and, you know, you were in the business. You were in the family business.
Yeah, I actually fell into so my dad is still a practicing oncologist, and he's hopefully on his way to retirement, but he's been practicing for now 40 years in the same neighborhood where I grew up, Gettysburg, Pennsylvania. And so I was not destined. I had a job at the FDA, and my junior year of college, I was going to head to the FDA to do devices. I was a biomedical engineer, and my father was faced with this really tough situation, which is he had this belief in comprehensive cancer care close to home, and he decided to build a massive cancer center in South Central Pennsylvania.
Oh, wow.
And 55,000 square foot building. He is a solo medical oncologist, built a radiation center. He built a radiology center, and he levered up our family. I mean, him and my mom 8 to 10 times. And he said, like, this is the vision. Now, he raised all that capital through the banks in 2006, 2007. So you know what happened shortly thereafter.
So that was like the last big financial crisis, obviously before. COVID, but that was before the Great Recession.
Right before. And so,
wow.
So I was a junior in college, and he had raised all this capital, built this beautiful center for our community. And the hospital in that neighborhood was owned by a conglomerate, and that conglomerate said, we don't let physicians own practices and businesses like this. And so they built
they went after him. They competitively went after him?
They actually built an identical center across the street.
Whoa.
Put in radiology, and then they bought nearly half of the physicians in the community. And so in 2008, not only did we have the financial crisis, a lot of my father's centers had shut down other than his medical oncology practice because he had been seeing all the cancer patients in that community for nearly 20 years at that time. And so he came to me and said, hey, Robin, I have a couple options. One of those is we could file for bankruptcy or we can try to fight. And I said, let's fight. Let's go figure this out. And I got thrown to the wolves. And I lived with my parents at the time, and we had this great balance, which is At the office, we worked hard. We fought a lot about the right path because there were so many bad things happening at the time, given the financial crisis, and trying to rebuild the practice. But when we went home, we were a family, and we learned a bunch. And it took about 3 or 4 years for us to restructure everything and his business to be thriving. And at that point, it was time for me to leave.
I love that story, not because obviously your family went through hard times. There's something about that family entrepreneurial story where it's you just realize it's make it or break it almost. I mean, it's it's one thing taking venture dollars and wanting to, but if it's your family, it's like you can't fail.
Yeah, I've been living in the you and I have worked together now in a couple of companies, and I feel like I live a bit more in the venture world now. But one of the things that we miss a lot of, and we see this at our company at Thyme Care, is that physicians, there are a lot of great physician entrepreneurs out there. We don't see it, but these healthcare practices are massive, and oncology specifically. What the oncology practices and physicians have done over the last 30 years is true entrepreneurship.
I was going to ask you on that note, how has being an oncologist changed in America since when you first got involved with your father, which was 20 years ago? When was it with your dad?
Yeah, 17 years ago.
17 years ago to today. Like how would you describe the changing landscape for oncologists, for the providers themselves? We'll come to the patients and other stakeholders, but how would you describe that? What are they facing today that they didn't face then, or maybe their opportunities or challenges?
Yeah, I mean, to think about oncology specifically, the evolution has really transformed from a individual practice, a bunch of entrepreneurs, call it 10,000 oncologists that are all entrepreneurs in the country, to big conglomerates. The oncology space has really consolidated to large managed service organizations or health systems, and the single doc, 3-doc practice like my father used to have 15, 20 years ago is far and few between. And so for the new breed of physicians coming into the market, for example, my little brother, who is a medical oncologist, it's different. They're not going out and starting practices like my dad. They are joining somebody else and learning it a little bit differently because when you are starting a business on your own, as a physician, you have to learn not only the business, you have to sort of evolve the practice. Now you are going directly into practice and hoping you can learn the business over time through the way the entire system is set up. And
scale is one because the health systems dominating the market. Scale is one because you need purchasing power, because oncologists have been very entrepreneurial and working with pharmaceutical companies and the various distributors in the drug chain. Scale wins because of why in oncology?
In oncology, those are the two main things. But I would say if I broadened it relative to the entire healthcare ecosystem, is that the administrative burden is just so much harder today. And I would say like some stats relative to oncology is in the community environment, the average oncologist is now purchasing nearly $7 to $10 million of drugs per doctor.
Yeah, we know it from our friends at House RX for sure, and what you guys do.
That's a big number.
It's a big number.
And then if you look at the sort of staffing ratios of physicians to clinical and non-clinical support to an oncologist, you're at about 8 to 10 to 1. So for every oncologist, you got to hire 8 to 10 people to support the population you're taking care of to build this. And so it's harder today than it was 10 years ago, 20 years ago when my dad was starting, where it was him and 3 people in his office doing that.
So you get your dad's business, you help get the business in good shape, and then you make a pretty big transition from like community oncology, hardcore healthcare services, patient-provider relationship to probably one of the more innovative companies in healthcare in the last decade, Flatiron Health, and probably one of the most successful companies in terms of just both the scale it achieved, number of employees, ultimate outcome for everybody, the quality actually of folks that spun out of Flatiron.
The talent coming out of there,
How did that shift happen? Like what made you go from hardcore services to more of a data play in healthcare?
Yeah, one thing that happened during that transformation that I mentioned with my father's practice and a bit of the financial crisis was during the Obama administration. They launched the Affordable Care Act. And one of the provisions that was within that was the requirement over a period of time to transition to electronic health record.
Yeah.
And in the first couple of years, there was a financial incentive, and then thereafter there was a penalty. But I think one of the things that people probably missed through that is that those penalties were exacerbated for oncology.
Oh, really?
Because it was focused on Medicare reimbursement, and ultimately nearly 50% of an oncology practice is Medicare beneficiaries, and you're operating on high dollars, as we talked about, and low margin. If you start to see 1%, 2%, or 3% penalties on half of your business, which that operates at a 4 to 5% margin, your practice will go under. And so you saw massive adoption in technology in the oncology space, primarily because of this. That introduced opportunity, right? As we look at every startup and organization, policy changes in healthcare create opportunity. And so one of the first things we did in my dad's practice through this process of transformation was launch an EHR. So we could be on the side of the benefit, because there was a reward for doing it early, which we got compensated for, which we did that. And
so when you started your practice, when you started your dad's practice, did he not have an EMR? He was like old school pen and paper?
Thousands of paper charts.
And filing folders and cabinets? Oh, that's amazing. So literally you were there as part of the meaningful use transition in oncology. Interesting. I didn't realize that.
I built a small little EHR implementation transition team. It was like a bunch of engineers that we hired some guys out of college and said, hey, let's go do this thing. And we had no idea what that actually meant because it was so early in the process. And at that time, we were actually thinking about building a business around just transforming the practice from paper to EHR. Realized that that's not that big of an opportunity. But no, all of this data was now living in these electronic health records. And I would say I was really big into quality improvement, value-based programs, even back then. But I didn't actually know what that meant. I don't think it was far enough along in its ecosystem, but I knew that there was this program in oncology called the NCQA certification, which you got reimbursed better if you did these things. And it was all around tracking data within your EHR. And I thought, wow, this could be a huge opportunity. But that process of understanding how to leverage data led me to the co-founders of Flatiron Health.
Yeah, Nat and Zach, right?
Yeah, Nat Turner and Zach Weinberg. And I met them in 2012 when the company was just getting started.
You were the third employee, is that right?
Something like that. I joined the team super early. And so as you know, in startup world, the first year, seed, pre-seed, you're on the team. There's three people, five people. There's no titles. And so I was, to 2012, it was me, Nat, Zach, and there was a few other people that were around the table. It was unclear who was a full-time employee and who wasn't.
And they hired you, no offense to you. They hired you, you're a smart guy, you're a compelling guy, I know that. I've worked with you. But they hired you because they thought, this guy really knows oncology. How did you get that job? Just out of curiosity.
Yeah, I would say three things. Number one, we were all the same age. So that was, so we were all similar. And number two, I think when we started talking, it's I knew what I was talking about. I understood oncology because I lived and breathed the problems that an oncology practice was dealing with every single day. And I had been doing it for 4 or 5 years at that time. And then number three, at that time, it was a smaller risk to take because I was 24 years old and I was of course I'll do this. Great.
I'll eat pizza.
Yeah. Actually, to be funny, I think the first 6 months I might have stayed at Nat and Zach's in my buddy's couch. I didn't have a place in New York. I was just sleeping around. We were figuring things out very cheaply, to get things moving forward.
You were there how many years?
I was at Flatiron for probably a little over 5 years.
What are your memories of that experience? What are the takeaways as it applies to the rest of your career?
Yeah, the most important thing is that you want to be building great companies with people that you like to work with. And it's carried forward a lot in Thyme Care. And, I think you know this, but nearly 8 to 10 of our leadership team are former Flatiron colleagues of mine. It's just a cultural thing that when you're working with people that you want to be successful, you care about their families, the updates on just what you're doing that day versus how your family's doing is just critical because you're spending 10, 12, 14 hours a day with these people. And that culture was a really big culture at Flatiron that I have carried through into Thyme Care.
What do you think made that at Flatiron so successful?
Yeah, a couple things. We, number one, we did not get scared of making mistakes. And we were not arrogant when we went and talked to clients or partners. We were super transparent on what we can do and what we can't do, and what we will build for them. And then most importantly, and I've heard this a lot from people, historically now, is that when we went and talked to a potential client or a partner, and we said, hey, like, here's what we're thinking about, and they gave us feedback, we would go back, we would evaluate that, we would come back 3 weeks later, and we said, here's what we learned, here's what we did, and here's what we can deliver for you. And I think that sort of customer-centric approach of not over-promising, under-delivering was the most critical thing to our success. We went and we never promised anything, we just talked about things that we think we can do, and we brought them along that journey. And ultimately, as the company got bigger, people were bought into building and scaling and testing things with us to become successful as an organization. So
we are going to talk about Thyme Care, but I do want to say you've on the ground floor, although not a founder of one of the most interesting venture-backed healthcare successes of the last decade, and in oncology. And then you moved to be a founder, I believe, or one of the early founder and members of probably one of the most successful private equity-backed ventures in oncology, which was One Oncology. Tell people a little bit about One Oncology, because I don't think it's necessarily as known as well as Flatiron, even though it's been highly successful, both commercially and financially. And what made that company a success? Maybe where was that company different than a Flatiron? What did you learn that you're now bringing to like a Thyme Care?
Yeah, so for those listening, Flatiron was purely a technology play around data analytics, as well as electronic health record, and powering pharmaceutical companies with oncology data that you can leverage from the EHR, electronic health record. One Oncology was actually, and I don't think many people know this, or everyone knows this, it was actually incubated at Flatiron Health. We started thinking about the concept in early 2017 around how do we leverage a partnership with a bunch of Flatiron customers that was deeper than a technology solution, but more around building the best practices of some of the best oncology practices in the country. And that was the thesis. There were these great Flatiron clients now. They were some of the biggest oncology practices in the country. They were all doing great things in their own practices, but there was no way to take what they were doing and then transition it to other portions of the market. And so we started incubating this at Flatiron. Flatiron then was going through an acquisition, so it made it a little complicated for Flatiron to be too involved in the actual spin out of a new private equity backed company. And so One Oncology is a oncology management services organization that partners with large oncology practices that are community based to effectively build economies of scale, but also allow them to learn from each other to become better within their own communities.
It's like you're doing for your dad, like years later, to compete against the health system. Basically, you're trying to help your dads out there.
You are spot on. And my father's practice actually ended up joining One Oncology.
Oh, really? I didn't know that.
And so my father is a One Oncology member today. My little brother is a One Oncology member today. Wow. My older brother actually works at One Oncology. So we are. It's
a family affair.
It's a family affair. But no, so right after the Flatiron acquisition, I moved to Nashville, and a team of us that were working on this concept around One Oncology sort of said, hey, let's see if we can get this to the finish line. And about 3 months later, the company officially launched in September of 2018 with 3 founding oncology practices in the country. And then from that point, the private equity-backed world is just a little bit different. And it operates different than a venture-backed startup like Flatiron Health. I learned so much through that process. But the company really has been able to deliver so much value, not only to its investors, but as well as the people that are within it that see the value from being a part of a larger organization like One Oncology.
Just at a scale, how many practitioners or clinicians, oncologists are in One Oncology now, roughly? Do you know?
Today, I think it's probably 1,000 oncologists.
Wow!
In the
so
country.
It's like
It's a big organization.
Big organization. Yeah.
Yeah. It could be larger than that. I'm a little bit removed now because I've been out of One Oncology for 4 years, maybe.
All right, we're going to talk about Thyme Care, and that's what we are full transparency investor in Thyme Care, and I'm thankful. I wish we invested more. I often say that about our best companies, but I've made a lot of mistakes in my life, Robin. You know that. Yeah. All right, let's talk about Thyme Care. I mean, you should tell our listeners what Thyme Care does, and then why is it different than what existed out there when you started Thyme Care?
Yeah, so Thyme Care is an oncology population management company focused on providing virtual clinical wraparound support for cancer patients that are going through a cancer journey and active treatment all across the country. And what does that actually mean? That means that if you have a cancer diagnosis, and hopefully you don't, but if you do, right now, the resources that you're looking to support you are your local physicians or someone that you know. And being in oncology for so long, one of the phone calls that I still get to this date.
I've called you.
You've called me. I've been plenty of people, and hey, someone that I know has been diagnosed with cancer and they don't know what to do. Can you help? And that's just a tough situation to be in. And there are currently not really any resources for that. You could try to call your health insurance plan. You have a low likelihood of success of getting to somewhere. Yeah. Your primary care physician or your physician will try to get you to an oncologist, but your oncologist is going to treat your cancer. And there's a lot of stuff that happens outside of just your cancer diagnosis. And so we started Thyme Care for that reason. And we knew nothing about value-based oncology. We knew nothing about how the health insurance plans worked in regards to risk for oncology populations. We knew that we wanted to help people through this journey. And what existed today in the marketplace was either sort of non-specific, non-disease-specific care coordination, or from a client perspective or a health plan perspective, utilization management or prior authorization, which is not a member or patient thing. This is a cost containment tool that health insurance companies buy on behalf of oncology. So that's what existed today. And we said, hey, let's build something for people that are impacted. And then we sort of learned from there.
Interesting. So you really started with the problem statement of there are, hundreds of thousands of people diagnosed with cancer each year, and I'm an expert. I'm an SME, to use your word, and I get all these calls, and that's not a scalable model. And so what do we do to kind of try to scale that model? It was really a consumer-facing kind of initial instinct around this company.
Yeah, and for clarity, there's actually more than 1.6 million new cancer cases per year.
I was off.
And so a lot of people impacted by cancer. I think our approach was, I think the first whiteboarding session, as every startup founder group would ever say, is we threw stuff on a whiteboard and tried to figure out what we're doing. The first concept was a direct-to-consumer model. We'll have a subscription service. And I think within the first hour, we said, wow, this is the stupidest idea ever. We're never going to build a business charging cancer patients. And so we walked away from that idea really quickly. And we felt super lucky because the next thing that happened, and it's sort of fortuitous in our journey of right place, right time, is a close friend of mine now, and was one of the founding board members of Flatiron Health. His name is Vivek Garipalli.
Yep.
He's the founder and chairman of a health insurance plan, a Medicare Advantage plan called Clover Health. And the day before the country shut down from COVID, I flew to New York with one of our board members. His name is Brenton Fagnoli. He was a colleague of mine at Flatiron Health. And we sort of put together this pitch or presentation on what we think we could do for Medicare Advantage patients. And we got the news the country was shutting down, and I said, I got to go to New York. So I flew to New York. We pitched it to him, and he said, this is a great idea. Got back in an airplane, went home, and then we were all locked down. But that ended up being a blessing in disguise, because now I was locked down just thinking about this idea, got the approval to move forward from Vivek. He actually sent us a bunch of non-specific claims data for us to start to learn, what does it mean to have claims data and what are the opportunities? And we built the business off of that. I called a bunch of former Flatiron colleagues and I said, hey guys, like here's a concept, here's an idea. And they all started jumping in. And fast forward to today, our head of engineering, our head of data science, our head of product, our head of provider growth, my co-founder, chief medical officer, our head of people, all former Flatiron colleagues who came in super early to help solve this problem. And so that's really the start of where Thyme Care began. And through that journey, we're now supporting over 50,000 actively treated cancer patients across the country. Over 270,000 people have access to our program. We have 400 employees today now. I think we plan to hire another 400 employees just in 2025. So a lot That's of scale awesome. In this business.
The learning, I mean, if I were to take it away, is, and you're an animal. I mean, I say that in a nice way. You like, if I think about you're like a commercial machine. I'm going to come back to that, but it sounds like you also have been able to be not transactional in that, but really relational. And while I don't think you necessarily have a lot of patience, maybe it's the high expectations from your parents. Like in healthcare, the learning might be you have to actually really work these things and be honest and be relationship driven. And frankly, that might be a 6 to 12 month sales cycle or even longer. And that's okay early in the days. Is that sort of a fair learning what I take away from you?
Yeah, I think like you said this in one of your prior podcasts that the healthcare journey of building a company is not a short-term thing.
Yeah.
You are building for the long haul. And you've said, I've been doing oncology for 17 years now.
That's pretty long.
And it's a long time. And if you think about like, I still have another 20 plus years to go in oncology. And so I took this approach in Thyme Care of like, we are not building to get out of this business in 4 years. And still today, like we have this mantra here, we are building to build something great that lasts with us or without us for the next 20 years. And we took that into our first few partnerships, and we still take that into our partnerships today, which is we want you to trust us and we want to trust you in this partnership. And if that is not the case, we shouldn't do it today. And I think that that's probably the biggest learning of anyone that's going to go into this is you need to invest in the time, because that person in health, especially in health plan world or provider world, is like they're making a decision on you as the person. And it's not just you, it's a team of people you're bringing around them. And what you probably have heard or found is like, I am in every partnership discussion. In early days, like I was in every conversation. I understood the nuances of things, and there's a lot of smart people around me who would support that. But I knew what we were doing. I wasn't disconnected from the actual product or solution. And that's extremely critical, because you have this massive ship that you need to be able to move very quickly. If your only customers are saying this is what we need.
Yeah, without revealing names, I remember we were doing a follow-on diligence round, and you were like telling me about all these people you were meeting with and you were doing things like on the weekends with these like executives of health plans, and I was sort of like, is this guy name dropping or whatever? But it's true. I think it's like core to your DNA. Is like it's the relation. You got to like work these relationships on many factors. And to your point, it's not just it's a business transaction. Like they have to actually believe in you and like as a human. I also took note like you were like doing things that other leaders didn't do to develop these relationships with these key decision makers at your customers.
I mean, just like I can see it from an investor perspective. Maybe this guy's just selling BS, but just to give you perspective, that same president of the health plan that took a bet on me/us, I went to Super Bowl with my wife this week, and we went to dinner that Friday night with him. Me and my wife went to dinner with him. So it's a real relationship, 3+ years later. And
I get it.
I think it's important. You're building great things with other people that are making bets on you. You want them to be a part of your success.
Totally. Hey, the other cool thing about Thyme Care is it is very much now a value-based care play. So I want to talk to you about the value-based care movement in general. Let's take a step back from Thyme Care. And first, I mean, you're now an expert in healthcare. Where do you think we are in the arc of value-based care?
Yeah, I think that oncology is a little bit different because there's so many dollars in oncology. But I would tell you, we are on this path to transform the way things are paid for in healthcare and specifically oncology. And those that resist it, I think, just like the small solo oncology practices no longer exist, I think in 5 to 10 years, when we look at oncology specifically, the organizations that don't start to progress to move forward into an orientation of reducing cost of care while also providing better quality, they will be left out. The trend in oncology is way too high. The costs are going up and no one can manage or control it. And I'll sort of reference something, this is not a political statement, but a lot of the discussions relative to what's happening in DC today is around fraud, waste, and abuse. I don't think that there's much fraud in this specific oncology ecosystem, but I do believe that there is likely a lot of waste. And I think that there's going to be a focus on managing that waste to make sure that we are receiving the value from the dollars that we're putting into it.
So as it relates to Thyme Care, I'd love to understand, where's Thyme Care today when it comes to value-based care, and where will Thyme Care be 5 years from now in your mind when it comes to value-based care?
Yeah, so I'll reference it as value-based care 5 years from now, and then where I think the company will be 5 years from now, because I think they're two different things. From a value-based perspective, like the way we think about it is there's a value equation, and the value equation equals quality divided by cost. And what we are seeing are really positive results in regards to the quality of our programs and the quality that people that have cancer get out of working with Thyme Care. That means that we have extremely high enrollment. We have really high engagement. We have people that are avoiding the ER. We have members that are very happy and satisfied with having access to our support. And we have great customers. Our providers and our health plans are happy. Right. The second part of the value equation is cost. In all of our reconciliation reviews, which is what value-based programs are evaluated on, given there's a delay, we're looking still at 2023. We are performing positively, meaning that, what the cost would have been. I've been telling you that for years, and
that's so true. I have bad hearing.
Yeah. But the results are now actually truly coming in, and what we're seeing is that Thyme Care, if you are in an intervention group with Thyme Care, the cost is lower than non-intervention group with Thyme Care. And what's so unique about that is it's not what we're doing is something we completely invented. We actually took something that was being built in pockets at a bunch of academic centers across the country, which it showed real patient outcomes and cost reduction, but no one was really able to scale that. And we sort of built a scalable model enabled by our technology and our product, and we're seeing that now come to scale. Where do I think this will be in 5 years from a value-based perspective? Is that I think that we will be so large as Thyme Care in some markets that that health plan or those people that are insured by the health insurance company in that region will have to have access to a program like ours, because not only you will be disadvantaged as a plan, your costs will be higher than everybody else. And so we are getting to a place where in some states we have 5, 6, 7 different contracts with Medicare and commercial plans, and we will be for that state the solution for everyone within that state. But separately, if I think about the company and where we will be in 5 or so years, we have this aspiration to transform the entire journey. And whether it's through us or enabling other partners, there is more that happens to the journey of a cancer patient outside of the treatment window, which we are hyper-focused on. That's where the bolus of cost is for people when they're currently going through active treatment. But for population basis, there's a lot of stuff going on for people that aren't being screened appropriately. And there's some really cool companies in this space. There's a lot of stuff that goes on in the peri-diagnostic period. So the period of time where you might have cancer, you don't know if you have cancer. And then there's a bunch of stuff downstream in regards to access to clinical trials, access to the right pharmacy, as some of the work you're doing at HouseRx, but then also access to the right providers at the right time.
For sure.
And can we enable a bunch of that stuff, given our platform will be so big and so many people will be touched by Thyme Care? There isn't other companies that have a human being communicating with a cancer patient throughout that entire journey. And if we can be the waypoint to a bunch of different organizations or support for cancer patients, we think that that's what will transform the entire experience.
And people don't want to talk about it, but even end of life.
And then
right. I mean, it's, to me, having a mom go through, with pancreatic cancer and gone through the other family members like that, if I had to do it again with my mom, she had stage 4, everyone wants to fight. She wanted to fight. And so I was going to be in the fight with her, but everyone wants to fight. But, in truth, a lot of the times the best decision is actually not chemo. Yeah. But like palliative care, when done right, which it often is a really humane way to, honor someone's life and end the life. But it's, so you guys, if you could have real impact on that, that'd be, no one wants to talk about it, but it is really important and humane.
Couldn't agree with you more. I didn't mean to leave that off because I think it's a part of the active treatment window. We actually have our own in-house virtual palliative care team. We have a in-house virtual palliative care doc. But the other arm of that is survivorship. I think they're, like in the event that you do make it through this journey, what do you do, and how do you have the right network? And there are some really cool companies out there doing that as well. And can we empower that? We don't need to own everything. Can we be the conduit to a bunch of stuff in the entire ecosystem of cancer?
All right. Well, everyone probably could tell that Robin's super excited about Thyme Care. I'm excited about Thyme Care. Actually, the opportunity is huge. So I'm just really excited that you built this company. I have a few quick questions I want to end with. I gave my view, but what do you think your superpower is as an entrepreneur?
Yeah, I go back to what you asked me about my childhood. The answer no doesn't exist in my vocabulary. And that's personal and professional. Like there is nothing that won't get me from point A to point B. There might be different paths to get from point A to point B, but for some reason I have deleted the perspective of failure, or I have deleted the perspective of no.
Love that.
And so even Steve, I'm going to give you even when you said no to me during our Series B, I knew that we would be back together at some point.
Yeah. You didn't let me go, and I didn't let you go. I saw something special, even though I made a dumb decision. I love that answer. The answer no. I got to delete it sometimes in my head. How did you choose the name Thyme Care? I just loved it. I love names. It's weird. Like as a venture capitalist, I love hearing the story of names. I think Thyme Care might be one of the best 5 names I've heard. It's spelled, by the way, for our listeners, THYME. So it's double entendre, I think. Yeah, but give me it. Give me the story, because it's such a great name. You want to provide your patients more time.
Yeah. And a bit of it is like we a friend of mine we hired who does this for a living. Said, hey, come spend some time with our management team, which was 10 of us then, and help us name this company.
What was the name at that point? Was there a holding name?
Ooh, yeah, there was a holding name. It was what I named the company first. I called it Live Free Health.
Okay, not as good as Thyme.
I get a lot of shit for that.
All right, so tell me about Thyme.
Yeah, so there is a part of the double entendre of having time through your journey. And having the right people around you. But there's also this sort of perspective of the word from its ancient roots that it actually represents compassion and care, that when we sort of heard the story of the person that helped us design the name and the brand and the color scheme and all of that, he presented it to us and we looked at it and said, wow, no brainer. No brainer.
Well, Robin, I'm glad I could spend a lot of time with you. We have multiple ways to interact, and I've, even though maybe should have made some smarter decision around the actual company itself and investing more. It was, no pun intended, really great time to spend with you today on the podcast. I really appreciate you coming on the Heart of Healthcare.
Yeah, no, I appreciate it. And I would tell you, look, I think it's always hard as investors to evaluate who you partner with. But I think it always makes sense. And the most important thing is how you treat people after. And Steve, you have been an amazing partner even after the early days. And I'm so excited about our relationship over the last 3 years.
Thanks. Feeling's the same. All right, my friend. Thanks for coming on.